This week we are talking about something relatively non-medical, but that affects every single parent of infants and toddlers, and that is potty training.
Yeah, we mentioned in an episode a few weeks ago that we've been able to potty train both of our kids now before the age of 2 years and got a lot of comments about what did we do and how did we do it. So we thought this would be a great opportunity to share our journey with potty training 2 before 2 with you. And just in case this is your first time meeting us, I'm Kurt, I'm a board certified pediatrician.
I'm Sarah, I'm a board certified OBGYN, and we are
the Doctors Bjorkman.
Welcome back. As Kurt mentioned, we are the Doctors Bjorkman, and we are by no means experts in potty training. But our goal this week is to kind of dive into our journey as parents, share with you some of the history and the data, as well as some expert advice about potty training. And we're going to share with you, that potty training well before 2 years of age is doable, and in many places and prior times, that was the norm.
Yeah, with that, we're going to use this episode to try to set you up for success in helping your kiddo use to learn the potty. We're going to cover some of those signs that you and your child might be ready to start that potty training and teaching, and then also share some resources that we found incredibly helpful for us with our children, including our favorite potty chairs, kids' books, and other resources for you as a parent. Before we can dive into tips about potty training, we wanted to talk a little bit about our own journey into early potty training. Now, during my residency in pediatrics medicine, I remember seeing a child for their 2-year well visit and asking the mom, who had immigrated from Malaysia, if she had started thinking about potty training yet, to which she giggled a little bit and explained that her daughter had been potty trained since nearly 6 months of age. Now, as you can imagine, this thought surprised me as something that I thought was really impossible at the time. But this mom ever so politely explained to me how at that time she just watched for her daughter's cues that she had to go to the potty, and then whenever she'd see those, she'd put her on the potty. And that with this, she hadn't used a diaper for her daughter since well before the age of 1 year.
I do remember this day because I was also really surprised when Kurt was kind of telling me the story about this amazing mama and kiddo. And then this sort of came back to the surface when we were going to have our first, because Kurt thought, oh, maybe we should do this with Cecilia. We did not. But we did learn there's this whole world of people who help their children learn to use a potty instead of diapers well before what is the U.S. standard.
Currently, in the year 2024, the average age for potty training in the U.S. is 37 months, or over 3 years of age. Now, there are many reasons for this, and we are by no means saying that 3 years is too old or that there are any negative effects to potty training at this age. But you may be surprised to learn that this is much later than what your grandparents did.
Currently, roughly 250 million diapers are used every day worldwide.
Wow.
So if you can imagine a world before disposable diapers, you might understand why it might be helpful to have your child learn to not go pee in their pants well before the age of 2 or 3. In fact, in the U.S., a standard infant care book from the 1930s recommended starting potty training at the end of confinement, which was like 1 to 2 months postpartum, and then finishing by the age of 6 to 8 months. Many of the recommended strategies at the time were very strict and regimented, and not always the best practices, sometimes potentially harmful, because they really focused on scheduled times and sometimes restrictions or devices to hold children onto a potty till they went. So not always the best recommendations, but this is just kind of the history where we were in the 30s.
Yeah, and as it was, in the 1940s, the standard practice was that most children in the U.S. were potty trained by 1 year of age. Now, this all changed with the invention of disposable diapers in 1959. Around that time, Dr. Spock started to encourage parents to respond to their child's cues and focus greater attention on what was termed child-centered parenting.
Yes. So then in the 1960s, a charismatic pediatrician named Dr. Brazelton led the way to encourage parents to wait until your children were ready. And this practice was also adopted by the American Academy of Pediatrics. It is interesting to note that Dr. Brazelton was later criticized for his strong financial ties to the Pampers brand and advertising like larger sizes of diapers for kiddos.
Yeah. Now, I can say it was so eye-opening to us to know that it was possible to potty train your child before 2 or 3 years of age. And looking back at this little summary over the last 100 years here in the US really shows how much of our behavior around potty training is cultural and not actually driven by our child's needs, their biology, or what they're capable of.
There is no doubt that keeping your kid in diapers longer has some convenience factors to it. You don't have to worry about accidents in the car or around the house while you're trying to get other work done. It also currently is way more socially acceptable with daycare and other childcare and support to have young children in diapers until 3 or so. So please do not feel guilt or shame or any kind of way if your kiddo is 2 or 3 already and you're watching this. We have been able to potty train ours before too, but this isn't reasonable or possible for many people. And so that's why we have this whole episode to talk about some of the signs and key things to think about. When is your kid going to be ready and when is a good time to start working on potty learning?
Yeah. One other thing that we want to touch on just really briefly is that there are many parents out there who think about potty training right away after birth. And that whole process and method is something called elimination communication, which really starts in early infancy.
Yes, and that is a whole rabbit hole that you can go down, elimination communication. There is a popular website book called Go Diaper Free if you want to check out that deep dive.
Which we looked into. It wasn't going to quite fit for our family and our lifestyle, but if that's something you're interested in,
it exists.
Check it out.
It's super interesting. Yeah. So on that note, though, if your babe is less than 18 months old, a lot of that potty training or potty learning does really center around some of that elimination communication model where you are really looking at cues from your child. And that has also been a major method of potty training throughout history. For most of you watching this, however, we imagine that you are closer to the average American or elsewhere in the world, wondering, how soon can we get our kid out of diapers? When are they ready for this?
Now, what are the signs that your child might actually be ready for potty training? Here are some of those 6 key signs we think are helpful to look for before you get started. Now, number 1 was that your child's starting to have longer stretches between wet diapers. As a child grows, so does their bladder, which allows them to go longer in between emptying. A part of this is learned behavior as well, but having those at least 2-hour periods between wet diapers is a really helpful sign that they might be ready.
The second sign of readiness goes right along with those slightly longer stretches between wet diapers, and that is having some degree of a pattern to the day around bathroom habits. Your child having some clear signs when they usually go to the bathroom can be really helpful as you work to help them learn to put that pee or poop in a potty instead of their diaper.
Now, a whole lot of teaching anything is that the learner is able to follow commands. And with that, our third sign is that the child is able to follow simple commands. Now, this doesn't have to be anything complex, but again, your goal is going to be that with positive cues and reinforcement, your child will learn to pay attention to their own bodily sensations. And so, them being able to follow little prompts from you is going to be really, really helpful.
Along with the ability to follow commands, the fourth sign, a developmental milestone that is shared by some is the idea that the child is starting to use 2-word phrases, more milk, things like that. So again, this isn't absolutely necessary, but it does kind of give a direction to where your child is at developmentally and is a nice sign that they might be ready for more standard potty training and potty learning.
Now, the next sign that your child might be ready for potty training are some of those verbal or nonverbal communications, either about having to go potty or more commonly that they've already went in their diaper. These cues are often things like saying pee, pee, or poop after they've gone in their diapers, or could even be nonverbal communications like pulling at their diaper.
And one of the final signs of readiness is that your child is starting to show interest in the potty. This can be as simple as watching their sibling or a caregiver using the bathroom, or an older children that might be asking to wear undies or climbing up on the potty. For us, it was definitely our youngest kiddos' interest as well as kind of communication about going to the bathroom, like pee, pee. That was a driver for us to say, hey, he's telling us he's peeing. Let's do this.
Yeah, absolutely. So for Bo, our son, he was showing these signs actually around 18 to 19 months. But for our daughter, it was a little bit different. She wasn't showing as much interest in the potty or communication about it. But as it turned out, like potty training was going to line up really well with a period in our lives as parents. And so we pulled the trigger on potty training for her around 22 months.
So much of the discussion about potty training, potty learning, or even elimination communication comes down to, are you ready as a care provider to do it? Of course, with elimination communication, the potty learning comes down to you paying extremely careful attention to your baby's little cues that it's time to go. But even with toddlers, the biggest sign of readiness is that you as a parent are ready and that the caregiving team for who's helping take care of your child is on board, in support, ready to commit to this process as a team for your kiddo. We're going to share all of our tips and tricks for actually starting the process in our next video, but our key to success, honestly, was just deciding that we were going to get rid of daytime diapers and then planning a time when it was going to work well for us to start.
Yeah. Now, the key here is that you're going to have a consistent block of time, either for yourself or when the child care providers involved can be on the same page about helping your child learn their body's signs and signals about needing to pee and poop.
Yep. There is this thought by some in very popular training methods about a 3-day process. And there most certainly is a great benefit to a more intense first few days of learning that we will detail next week. But it's important to remember potty training, potty learning is not a 2 or 3 day thing. This takes time. Your kid's learning a totally new skill. And so it's going to take more than those 2 to 3 days to get it down and be done with accidents. So we just want to encourage you to know that accidents will happen, and through it all, your job is to just stay positive and continue to create an environment for success. Which brings us to, what do you need to be ready to start potty training?
So as we already started to mention, the first step in potty training is really having a dedicated block of time to get started. Now, for us, we were really intentional about having this 3-day kickoff weekend where the plan was we were home, we weren't going anywhere, and really the goal of the whole weekend was just to make sure that all of the pee and poop went in the potty without distractions to take advantage of all of those opportunities for learning.
Yes. And we were very intentional about this because, again, it's a skill. They're learning something new. We're going from, hey, we pee and poop in a diaper, to this is supposed to go somewhere else. So it takes some time to help them associate their body sensations with that need to be sitting on the potty. And so being home, watching your naked toddler, getting them to the potty when they start to pee is just really important to start making those associations so they get it. And you don't want to be distracted or having to run errands or out and about doing things while trying to do this. It's just too tricky.
Yeah. So after that intensive start period, the next thing is to make sure that there's going to be a system to carry forward this process. So which for many is going to mean making sure your daycare or other childcare providers are on board with what you're doing. For us, this meant for Cecilia that her toddler preschool daycare was aware and on board with our plans. And then for our second Bo, it was sharing our plans and making sure that our nanny knew what we were doing and what our strategy was.
Yeah, it just isn't complete in 3 days. No. So you gotta keep it going.
Carry it forward. Yeah.
And then the third thing about making sure that you as care provider are ready to potty train is really about having the environment set up to make it easy for your child to use the potty and figure this out. For us, that meant a good potty chair in the bathrooms, and then a little potty that's easy to take on the go. It's in the car. There is never a rush to find a potty while you're out of the house, and we will link our favorites in the description below. Our absolute must-have is this little potty. It goes everywhere with us. Our kids have peed in the back of the car, outside, everywhere.
Road trips around town, even like sits out on the porch when we're playing outside, just to make it that much easier to say, hey, it's potty time, here's where it goes.
Yes.
I think Sarah stated it really well in that the biggest part of your child being ready to use the potty is you being ready to teach them. The process doesn't happen overnight. But with a little planning about your time, setting up the environment, and a continual positive attitude, you can do it.
And so can your kiddo.
Yeah.
So we are going to share all of the details about that first start to potty training in our next episode, as well as other tips, tricks, and troubleshooting little issues that come up along the way. So make sure you are subscribed, and we will see you all next week.
Yeah. Bye, guys.
We're doctors.
But not your doctors.
Anything we've said in this video is for education or entertainment purposes only.
It is not medical advice.
Any specific medical questions you have should be directed to your provider.